This is Heather Edmonds, Program Associate with the National Aging and Disability Transportation Center. Welcome to this session on multimodal approaches in accessing healthcare services. I'm pleased to have with us Sandra Carson, Aging and Disabilities Resource Specialist for the Middle Georgia Regional Commission Area Agency on Aging. Sandra has 16 years of experience working in the Area Agency of Aging, dedicated to researching and assisting citizens with community-based resources. She has achieved the Alliance of Information and Referral Systems certification for Information and Referral Specialists in Aging and Disabilities. Her knowledge of the community served by the Middle Georgia Regional Commission Area Agency of Aging is expansive. Sandra remains dedicated to helping older adults and people living with disabilities find and advocate for services they need. I'm happy to have Sandra here to talk about Middle Georgia Regional Commission's Dialysis Transportation Program. Now we'll turn things over to Sandra.
We'll be talking about the journey of the Middle Georgia Regional Commission Area Agency on Aging into the land of dialysis transportation. We welcome you to join our transportation journey. Today's presentation, we will target the following learning objectives: identification of need, SWOT analysis, project deliverables, project implementation, Memorandum of Understanding, choice of transportation provider, measurable outcomes, lesson learned, and finishing with replication possibilities. So, let's begin the journey. Identification of need. After we reviewed the annual update to our area plan, we identified a rural county in our service region that has no public transit system. However, the senior center in this county participates in a non-public coordinated transportation system, which takes the senior to and from the senior center. Located closely to the senior center is a dialysis center. During routine trips to the senior center, the transportation provider noticed an older adult walking to and from the two locations on multiple occasions. At this point, the AAA soon learned that this person has no means of transportation to their hemodialysis treatment appointment. Now, this created the situation where we began to consider what we could do to help the older adults in this community with no transportation to and from dialysis. This identified need and desire to help led to the following analytical realities. Let us look at some strengths. The AAA has a transportation program currently serving the senior center within one of two doors of the dialysis center location. Then we looked at the funding. Allocated funding for adults 60 and up to receive transportation services through the State Unit on Aging and Georgia Department of Human Services, and an annual strategic planning process which identifies transportation as a focus area. Now, we did have some weaknesses. So the county weaknesses are, it does not have a public transit system that can serve the older adults with limited to no transportation access. And another weakness is, it has older adults living with limited to no transportation access. So you see, when you see an opportunity, you work with it. So the opportunities are, the agency contracted transportation providers saw the need for dialysis transportation and felt strongly enough to advocate in favor of this service. This desire to serve this need is already built in for this provider. Transportation to the dialysis center was not an extra burden on the transportation provider because of its close proximity to the senior center. The dialysis center was already interested in the potential service through the service provider, making inquiries of center staff. Again, the desire to serve the need is already present and didn't require prompting. Remember, the AAA had funding that may be used for this program if the state agency was willing. This would require inquiring and communication. Yes, we did have some challenges here, and we had to face those challenges. The challenges to make a successful project to launch, we had to define the parameters for service availability, including the project ability and limitation, ensuring the participant health and safety, and last, achieving program partner agreements, including the scope of services. This internal analysis led to a discussion of project deliverables, what did we want to achieve? Now, project deliver achieve. The aging transportation must include wheelchair accessibility. Number 2, the agreement by the state agency to fund the transportation program. Number 3, access to training to complete client data entry and scheduling of trip services for the participant riders. Number 4, a formal written agreement between the Middle Georgia Regional Commission and the Dialysis Center. Number 5, teaching the Dialysis Center a process for client referral to access to transportation services through the AAA, and then we begin implementation of the services. So, the AAA had conversation with all parties involved and created a written MOU for the MGRC and the Dialysis Center. Here's where project implementation. The AAA created the formal Memorandum of Understanding between the Middle Georgia Regional Commission and the Dialysis Center. The referral process was developed and staff was trained. Then the AAA staff was granted access to the state agency funding, data, and trip ordering system and services began in March 2017. Now moving forward with the Memorandum of Understanding, the AAA determined the parties to be involved in the project, which included the Georgia Department of Human Services, Middle Georgia Regional Commission, Area Agency on Aging, the Dialysis Center, and the contracted transportation provider. So, we know we had to get a written agreement with the Dialysis Center in order to initiate the program. In the MOU, we specified the goal of the dialysis transportation, identified the transportation provider as the Department of Human Services Coordinated Transportation Program and the Middle Georgia Regional Commission Contracted Service Provider. Then we defined the participants eligible for transportation services, specified the type of transportation services and the limitation therein. Now this included the medical monitoring of stretcher services, no medical monitoring of stretcher services, no add-on stops to the transportation trip, and when the transportation service is unable to provide service, the participant is responsible for securing alternative transportation. Notify all parties of the required time frame for adding a participant or scheduled trip to the transportation service. Service is subject to fund availability and is in effect unless terminated by written notification. Through clarifying these items, all parties within the project became aware what the transportation project could do and would not do. Here's where we're going to talk about contracted transportation provider. The dialysis transportation services are paid by the Georgia Department of Human Services Coordinated Transportation Division, and the Middle Georgia Regional Commission serves as the contracting arm of the Georgia Department of Human Services Coordinated Transportation for Area Agency on Aging Transportation Programs. Then the provider for this service is the contracted transportation provider established in the region. They have paid drivers, a fleet of vehicles, insurance, and DHS-approved billing system. The provider is subject to inspections, annual monitoring, and oversight by the Middle Georgia Regional Commission and the Georgia Department of Human Services. The vehicles used are wheelchair-accessible vans and minibuses, and the program does not transport individuals who would require medical monitoring or stretcher services. Program funding includes Older American Act Section 5310, which means the transportation funds used by public transportation programs. With all these pieces now in place, the program moved forward. And now looking at our measurable outcomes, the program began around March 2017 with 4 participants. Program at the time of review in February 2019, we were serving 7 participants. As of today, we're serving 8 participants. Between July 1, 2018 and February 28, 2019, the participants met their dialysis treatment with a 94% reliability. This was great. This figure was based on trips paid by DHS reported in the data system. Based on internet research, a routine clinic dialysis treatment costs approximately $500 per treatment. If the person requires emergency room treatment, the cost increases to $9,900. This is quite the potential savings in overall health care costs by meeting regularly scheduled dialysis clinic appointments. The cost paid by the Department of Human Services for the transportation trip during this time frame totaled $28,000. This is a large savings to health care expenses since dialysis appointments are commonly 3 days a week, every week. In totaling, using the figures from the internet research, the potential healthcare saving is an estimated $6 million. As we are all aware, no program begins and proceeds without learning some lesson. Along the way, we did learn some lessons. That all parties need a clear understanding of who is responsible for each function needed, what the service can provide, what the service cannot provide, and why. The best case is to put this in writing since staff turnover does happen. Make sure you have a conversation between the transportation provider and the end user, the dialysis center, especially. Make sure all parties are okay with the transportation schedule needed and boarding and exiting the transportation procedure. Make sure you have one AAA staff assigned to the program to be the contact for all agencies involved. You know, there will be times of inclement weather when the AAA transportation service do not run and the families must have alternative arrangements. There will also be times when an unusual circumstance may arise, like a participant who cannot participate temporarily and will need to be reinstated to service later. With all things considered, the benefit and the lesson learned, we believe the transportation project is well worth the effort. If you are interested, we believe the program is replicable. Replication possibility. Prior to deciding whether your agency replicates the program, we recommend that you assess the needs of the communities served by the Area Agency on Aging, evaluate the existing services in those communities, determine the stakeholders and potential partners needed to provide the services, and begin the conversations. Develop a Memorandum of Understanding, clearly define the goal and expectation of all parties, including any participant requirements. Begin implementation, evaluate success and any potential changes needed, and keep all partners informed. As I close, we appreciate your interest in this program. Although this is our first effort at this type of initiative, we hope the methods and processes we use will serve as a useful guide for you. Should you need more information, please feel free to contact us, which you can contact me, 478-751-6466, or by email, scarson@mg-rc.org, or Julie Hall, the Area Agency on Aging Director, 478-722-6975, or by email jhall@mg-rc.org. Thank you.